PhD today. We're going to talk about suicide prevention.
The Army is committed to keeping its soldiers strong, both physically and mentally. The men and women working in MOS, behavioral health specialists, are compassionate, effective communicators who are able to remain calm in stressful conditions.
All right, good morning, everybody.
And are dedicated to supporting and promoting the emotional health and well-being of their fellow soldiers. The behavioral health specialist works under the supervision of a psychiatrist, social worker, psychiatric nurse, or psychologist to assist with the counseling and treatment of patients who have personal, behavioral, or mental health problems.
To be a 68 X-ray, you need to have a strong sense of compassion and be able to care for others. You'll not only be faced with technical challenges, but you'll be faced with human challenges as well. You'll have to work with others, invest in others, and assist others without judgment.
Soldiers wishing to classify as behavioral health specialists must first complete 10 weeks of basic combat training, followed by at least 17 weeks of advanced individual training at the Medical Education and Training Campus at Joint Base San Antonio, Fort Sam, Houston, Texas. As a behavioral health specialist, you will train in the basic understanding of psychiatric disorders and learn to conduct interviews to collect and record psychosocial and physical data. The Army will train you to administer and score psychological tests, including intellectual tests, personality inventories, and tests designed to discover organic damage to the brain. You will also train to assist in assessing an individual's level of function, develop and implement treatment plans, as well as learn the fundamentals of combat stress control, such as unit outreach, prevention, and education and traumatic event management.
One of the important qualities that you need to have as a behavioral health specialist is being compassionate and having that empathy, because you need to put people's need before yours.
And also resilience, integrity, and to be able to maintain confidentiality are also very important.
You will train to assist in diagnostic procedures, to include measuring and recording vital signs, and to assist with routine nursing care, such as administering medication under the supervision of a licensed nurse, maintaining a therapeutic milieu, and by supervising a patient's daily activities, such as escorting patients to medical appointments and recreational activities.
Being a behavioral health specialist in the Army comes with several rewards. Personally, one of the most rewarding parts for me is when a soldier comes in at the lowest point in their life and you are able to step in and be a life-changing intervention for them. You can watch them grow from what was a very low point in their life, overcome those obstacles and those problems that were facing them, and get to the point where they are even stronger and even more effective than they were when you first met them.
After your initial entry training, you may be assigned to a fixed facility or to a field unit. You may be assigned to a combat stress control unit, an inpatient psychiatric ward, a drug and alcohol rehabilitation program, a research facility, a correctional facility, an outpatient behavioral health service, or to social work, where your duties may include case management.
As a behavioral health specialist, you can have an array of assignments. You can work here in the United States, or you can also deploy. While you're deployed, you can work with the combat stress teams, where you get to see soldiers who are experiencing combat stress reactions, and you're able to help them out.
As a behavioral health specialist, you will be trained to present your findings in a written
Let's start with the first patient.
and verbal report to other medical personnel or staff for final disposition by a supervisor. Soldiers in this MOS will maintain confidential records and may receive additional training in drug and alcohol counseling and other advanced treatment techniques. Serving as a behavioral health specialist can help you prepare for a variety of civilian careers when you transition from the military. Your experience in communication, teamwork, and problem solving, combined with a more developed sense of leadership and self-discipline, are skills and values in demand by civilian employers.
There are a lot of medical jobs in the Army, but I think behavioral health specialist is one of the most important. Some of the things that we do are really to take care of the warfighter and to be a force multiplier in the Army. What that means is that as soldiers come to us, we help to keep them in the fight and keep the soldiers around them just as strong and resilient.
Military occupational specialty, behavioral health specialist, serving an important role in the Army Medical Department endeavor to conserve the fighting strength.